Safety is so important for us here at Hawkesbury because we want to ensure all our staff are well looked after while they're at work.
We all need to go home safely, not just you, but your colleagues as well. The approach to safety when I first started was very limited. It was quite frustrating to see that caregivers, workers weren't engaged in the process and didn't think they had a part to play.
It was very much, she'll be right. It was about, let's get the job done, we're in a hurry.
We were once the worst performing hospital within the St John of God group, and now we are one of the best.
We've lowered our injury rate spectacularly, and we've seen a huge improvement in people's attitudes, and I'm really, really excited about that.
I suppose some of the tangible improvements are the equipment. We've got almost 100 new beds now. But for me, it's the culture. It's the change in what people say and how they feel. The fact that they actually think that management care about their safety, that's the biggest thing for me.
The approach from the leadership group is to be inclusive of all staff. We do a regular rounds with the ward staff to identify risks with them and also to talk with staff that have had injuries at work to let them assist us to rectify the problems.
So we've worked really hard on our manual training, but also training around electrical safety, around safety with gases, around storage issues and things like that. So it's being able to get there and intervene in the daily tasks.
My experience of being injured at work initially involved me having a fall where I injured my knee, and at the time I was very hesitant about saying anything and I thought it would be okay, but then I was encouraged to discuss it with my manager. Going through the experience I felt a very supportive process from the moment that I mentioned I had an injury to the moment that I returned to work. At the end of it, it was very supportive.
Something we've done recently is that we've just done an audit of staff members' beliefs around work health safety, and so we've seen a massive improvement from when we first did it in 2016 to when we did it last month. It's the investment that the leadership have put into buying us the equipment that we need, giving us the training we need, making sure that as committee members we could go and be trained so we could do our job better. They've given us a lot of backing, so they come to all the committee meetings and they make sure that what we raise with them actually gets actioned.
We are most proud of our efforts over the last 3 years by the improvement in the collaboration with our staff, the cooperation of our staff.
I feel the hospital has very much highlighted their importance for work health and safety. I feel that it's a very approachable subject, and I don't feel that there's a stigma amongst the hospital that if you did have an injury that you shouldn't say anything.
Safety is now on the forefront of people's minds. It's no longer an afterthought. It's now something that people think about and that they're actively engaged in and they feel that they can make a difference in.